All right. Hello, everyone, and welcome. Thank you so much for being here with us today. My name is Stephanie Will. I'm the Mental Health Services Program Manager here at Montgomery College, and I am a licensed clinical professional counselor. I work with our Student Health and Wellness Center for Success, or the Shaw Center. We have a number of different programs that we do under Shaw. One being our Fuel for Success program that puts on programs such as the mobile markets, lunch on the go, grab and go snack bags, wonderful things like that. We also offer our social resource program. I do lots of different mental health programming, things that include like Mindful Mondays, the mental health first aid certification training. We also have our health safety education branch of the Shaw Center that does things like our bystander intervention program and a lot of trainings regarding sexual assault awareness and prevention. And finally, we also have our physical health wellness branch, and we do lots of cool classes like Zumba, belly dancing, and yoga. Plus, we are able to offer things to students like our flu shot clinics. So at the Shaw Center, we do a ton of different stuff. And as the mental health person, in addition to talking about things like depression and anxiety, I also really love talking about substance abuse, and not just substance abuse from a diagnostic perspective, but being able to use some substances responsibly. And so that's what we're going to be talking about today. Enjoying life responsibly. How do we stay safe and still have fun when we go out, maybe go to a party or a gathering with some people? So, what we're going to be talking today about is primarily alcohol use. So, let's start off with like, why do people drink, right? Maybe you're here because you drank and maybe you lost a little bit of control and you're like, okay, how do I do this responsibly? Um, Maybe you've never had a drink before and you want to get some information, or maybe you're here to do a class project. I don't know. I'm just glad that you're here. Um, but there's a number of reasons that people do consume alcohol. One of the big ones is that it tends to make people feel less inhibited. People oftentimes think it makes social interactions a little bit easier, especially if individuals are shy or a little bit anxious in social situations. They tend to feel like it's more fun when they drink, when they're interacting in that social environment. I'm sure many people have also heard the phrase liquid courage, that it gives people a little bit of bravery that they may not experience normally. Um, some people feel like it makes them feel more sexual, or more aggressive, and just generally more disinhibited, and that they're more willing to do things that without any sort of impairment they wouldn't necessarily do. Some people drink alcohol to numb feelings of pain, like when we've experienced traumatic events in our life, if we're experiencing a lot of anxiety or maybe depression. Oftentimes, people think if I have some alcohol, then I won't feel those negative feelings so intensely. Some people drink to fit in. You go to a social situation, and even though you might not want to be less inhibited, if everybody else is using a substance, you may think that, okay, well, I need to also, so that these people will accept me, or at least just so I don't stand out among the crowd as being the only person who isn't drinking. And some people enjoy the taste of alcohol. There are so many different craft alcohols, craft beers. I've seen tons of craft liquors and things like that. Yeah, there's a lot of different flavors of things out there. So some people really just enjoy trying and tasting all different new things and experimenting with recipes, and whatnot. So there's a number of reasons why people drink. And one of the things that I'm not going to do today is, preach and say, you shouldn't drink. It's a bad idea. You're going to get hurt, or negative things are going to be the only thing that happen to you. Um, I'm I don't believe that that's the way to go about doing things safely. Today, what we're going to talk about is really what are the impact objectively, what are the impacts of alcohol on our body, on our mental status, And when we do go out and we do decide to drink, how do we do so in a safe manner so that everyone gets home in one piece? And again, as you saw in the opening slide, this presentation was originally created for Sexual Assault Awareness Month. So we'll talk a little bit about how alcohol is used in sexual assault, um, and what are some of the things that we can do to help prevent sexual assault when we are out in a social situation. So some of the other things to think about when we're talking about why people drink, environment really does play a large part in not just whether or not people consume alcohol at all, but how much alcohol people tend to drink, especially in one sitting. We need to think about, how does our culture view alcohol? What about our family? If our religion is a really large part of our life, how does our religion view alcohol? The people around us, our friends, are they big drinkers or are they not? If we're not around a lot of alcohol or not around a lot of people who drink alcohol excessively, we're probably less likely to do so ourselves, just because that's not the type of environment that we're in. We also need to look at, what are the social norms? What does media and generally society tell us about alcohol and drinking? In US, I'm not sure about some other Western cultures. I couldn't speak to, maybe like Western Europe, um, or even South America, but America very much glamorizes alcohol use. It is ubiquitous in teen shows, just about every, I think, movie or TV show that shows college students. There's always drinking at least once in the course of the movie. And it's not always necessarily a negative experience, but it's not always necessarily a positive experience. Some people may have heard of the after school special episodes where, they'll talk about the dangers of drinking in an episode of something like Saved by the Bell. But then we have other shows like Gossip Girl or Vampire Diaries that show teens drinking without even a second thought to it. So, this American culture, we really do glamorize the use of alcohol, especially the use of underage alcohol, and don't really think twice about that as being something that's normal. In movies and TV, alcohol is very much linked to sexual desire, sexual performance, being aggressive, people getting into bar fights, and just generally other types of disinhibited behavior. And another major factor is accessibility. How easy is it for a person to get alcohol? Because if it's not very easy, then it's going to be, you're less likely to drink if it's not something that's readily accessible to you. So again, if it's in your house, if it's in the houses of people that you spend time with, it's going to be more easier to access than maybe somebody who doesn't have those types of connections or doesn't have family or friends that drink. As we go through this presentation and as we're talking about a drink, we tend to think of, oh, like a glass of wine is, fill up the glass of wine, right? But that's not actually a standard drink. So if somebody is talking about what is a standard drink, it's actually only 5 ounces of wine. It's much less than a full glass. Again, 12 ounces of a regular beer. I believe like if you are going out to a restaurant and you order a pint or a 16 ounce, you're already having more than one drink in just that one glass. Malt liquor, things like Mike's Hard Lemonade, and I'm not sure about all the hard seltzers now. That's not something I enjoy. So I don't know what the percentage of alcohol is in that. So I don't know quite what is one actual serving, one standard drink there. But then also when we talk about shots and hard liquor, that's only about 1.5 ounces that equals one drink. So if you think about a drink like a Long Island iced tea that has, I don't even know, like 3, 4, 4.5 shots of different types of alcohols in it, in one glass, you're having 4, maybe 5 drinks. So, when we think about it, like, oh, I just had one drink, but you really didn't. You actually had like 4 or 5 drinks in one glass. So it's just something to keep in mind and keep in perspective as we're talking about, how many drinks in a day, um, or things along those lines, or even just for your own knowledge in being safe when you go out, to a bar, to a friend's house, or something along those lines. That it's really easy to drink a lot more than you realize very quickly, just because of the way different alcohols tend to be served to us. So, first, we're going to talk a little bit about acute intoxication, which is basically you have drunk alcohol and with it in the immediate, you know, 20, 30 minutes to a few hours afterwards. These are some of the experiences that you might have. So, people tend to report feeling increased chattiness, they're talking a lot, maybe increased confidence. You're maybe talking to people that you wouldn't normally talk to. We also see delayed reaction time. This is one of the reasons why um, the country is so strict about drinking and driving, because the time it takes us from when we see an obstacle for that information to then go to our brain and then be relayed to our foot to step on the brake is going to be a lot slower than if you've not had any sort of alcohol or other types of drugs in your system. Generally, it decreases inhibitions. That part, or that kind of rational part of our brain that tells us this might not be a great idea, gets turned off, or at least quieted significantly when we've been drinking alcohol. So people tend to do things they wouldn't normally do. We also see reduced impulse control. So again, that is kind of the other side of reducing or that decreased inhibitions. We're not necessarily thinking things through before we act, and it's easier to make dangerous decisions. We also can experience a loss of judgment and memory. If you've heard of like blackouts and brownouts. A blackout is if you don't remember anything. A brownout might be you remember certain bits and pieces. But even if we're not that heavily intoxicated that we're blacking out or browning out, we can still have some holes in our memory from that period of time when we're drinking. Eventually, the more alcohol that we drink, it can cause vision problems, seeing double, our vision blurry. It starts to impact different areas of our brain, and it impacts our balance. So you might not be able to stand up or walk correctly. Other people might need to help you. Drowsiness, that you desire to pass out or fall asleep. It could also lead to a lot of confusion, just not knowing what's going on around you. So the more we drink, the more of these effects that we're going to see. And some of them, again, increased chattiness seem pretty benign, pretty harmless. Like, oh, it's not such a big deal if I'm increasingly chatty, right? I feel okay. But once we start losing chunks of our memory, once we're not able to walk or stand on our own, that gets into some of the more serious consequences of that acute intoxication. So I always like to ask people, what is it that helps sober you up? There's a lot of different tricks out there. People say, give a person coffee, lots of water, making them eat something greasy or something with a lot of carbs to soak up the alcohol. But the reality of the situation is time is the only thing that's going to make us more sober. Basically, the alcohol, once it gets into your stomach and begins to be processed, it goes into our bloodstream. And once the alcohol is in our bloodstream, it doesn't process any faster or slower given anything else that we might do. The only thing we can do is just wait to sober up. So, something to keep in mind. We can't go out, drink excessively, and then say you're going to have a lot of coffee, and then, my parents or my roommate or whoever, I'll just drink a lot of coffee and they won't know that I had been out drinking. That's just not the way it works. So I really love this video all about alcohol in your brain. So it's kind of technical, but it does a really great job of explaining uh, how how alcohol impact just what it does to our brain, how it chemically impacts um, what we do. So let me just get this set up really quickly. Okay.
One of the most commonly used and abused drugs in the world comes in a variety of forms and does one thing quickly and well: it changes the way you feel. But to what do we owe these feelings of release and freedom? How could the ingestion of one simple substance so drastically change not only your actions, but thoughts and perception? As alcohol enters the body and makes its way to your brain, it begins to interact with your neurons or brain cells. In our previous video on marijuana, which you can click here, we explain the actions of neurons and their chemical messengers called neurotransmitters. But there are two main types of neurotransmitters that these neurons use to communicate or send electrical signals. Excitatory neurons use glutamate, while inhibitory neurons use GABA, the yin and yang, if you will. Much like the zeros and ones of a computer, these two messengers have contrasting roles. Glutamate begins a wave of excitation, while GABA not only inhibits this flow, but helps to organize and differentiate the results in your brain. And just like a computer, these signals can be combined in enormous complexity to form actions and thoughts. So how does alcohol affect these two signals? Turns out it suppresses glutamate transmission and enhances GABA transmission, so you get less excitation and more inhibition. And because glutamate sites become less effective, information flow becomes slow, and only the largest signals can make it through. This means you feel less, perceive less, notice less, and remember less. In conjunction, the increased GABA hushes the excessive background noise of activity, fine-tuning and clarifying your thoughts, but to an excessive degree. This is why you may have heard that alcohol is a depressant, but inhibition of your neurons is not the same as social inhibition. Instead, it simply cleans up and removes extraneous activity by removing less significant excitation. Without normal GABA transmission, the excessive excitatory action would resemble an epileptic seizure. There would be no clarity of thought. While drunk, your GABA channels are wide opened. Combined with the lack of glutamate, you begin to think very little, but with great clarity. It's what causes the momentous attitude of a drunk, often repeating the same idea or proclamation over and over, thinking clearly about almost nothing. Got a burning question you want answered?
Okay. So yeah, so for those of us who are science nerds, I just find that a wonderful explanation about how alcohol really does impact all of the different chemicals in our brain and why we experience those acute intoxication um, results. So, if a person has been drinking heavily for an extended period of time, one of the things that they might experience is something called withdrawal. And that's basically our brain and our body builds a tolerance to the alcohol over time. So maybe a year or two ago, you could have one drink and you'd be buzzed and you'd feel good. But now, a couple of years later, to achieve that same buzzed feeling, you might need to drink 3 or 4 drinks. Again, that's our body building up a tolerance to the alcohol. And basically, what that boils down to is that if we don't have the alcohol, our body isn't producing those same feel good chemicals that it normally would, because with all of the alcohol and all of those chemicals in the system, our body was like, well, I don't need to produce them anymore. So when we take away the alcohol, our body isn't able to compensate for not having them. When we talk about a hangover, most people don't realize that hangovers are actually mild withdrawal from alcohol. And they can start about 6 hours after the last drink that a person has. And if anybody's ever had a hangover before, you know it often comes with headaches, nausea, vomiting, insomnia, sweating, anxiety, and even shaking hands sometimes. It's just generally a really unpleasant feeling. And again, it can go beyond a mild headache or a little bit of vomiting and can become more intense with the more alcohol we drink or the more frequently that we tend to drink. Something called the delirium tremens or DTs is something that happens in really severe withdrawal, and it can appear within 48 to 72 hours of a person's last drink. Um, this is something that can cause confusion. A person might not know where they are, what's going on, racing heart, high blood pressure, fever, and heavy sweating. Um, Alcohol is one of the few drugs that withdrawal can actually be fatal to an individual. Again, if a person's been drinking a lot over a long period of time, um, a person can experience these DTs, and they can get even more severe, eventually causing hallucinations, a person hearing or seeing things that aren't actually there, and they can cause seizures and death as well. So if you know a person who may be abusing alcohol, drinking many drinks every day, um, we talk about something called detoxifying, as a way to basically stop drinking and get it out of your system. Um, Oftentimes, depending on how much a person has been drinking and for how long, we recommend something called medical detoxification, which is actually an inpatient program where the person is put on medication to be able to have the effects of the alcohol leave their system more slowly so that those DTs and seizures, hallucinations don't happen. And it can keep that individual from having these serious effects, including death. So, something to keep in mind if you do know somebody who is thinking about getting help from drinking. If a person has 2 or 3 drinks a day and has been drinking for 6 months, you're probably not going to need a medical detoxification. But if you have any doubt, going to an emergency room is really key, because we want to make sure that people are doing this in a safe way. So, moving from withdrawal to overdose. Overdose is essentially too much alcohol in your bloodstream. So, we talk about drinking and driving and how 0.08 is the legal limit, but you've heard of people maybe having 0.1, 0.2. I mean, in very rare cases, you might hear somebody having like a 0.3 blood alcohol content. And these are individuals who might end up with alcohol poisoning because there's just too much in their system. And what this ends up doing is it can depress our breathing. In the video, they talk about alcohol being a depressant. What it does is it slows your system down. It doesn't make you necessarily feel depressed. It depresses your ability to breathe. It depresses your heart rate and slows it all down, lowers your body temperature. And obviously, if we stop breathing, if our heart stops beating, or if our body temperature goes too low, that can cause death. And that's, where this goes into an overdose. If a person is drinking and also using opioids or benzodiazepines, opioids are things like heroin, OxyContin, Vicodin, Percocet. Benzodiazepines are things like Xanax or Abilify, or not Abilify. Oh gosh, Alprazolam, things along those lines. Those are also opioids, and benzodiazepines are also depressants. So when you're adding depressants on top of depressants, the risk of stopping breathing, the risk of your heart stopping is going to increase significantly. So if you think a person might be in an overdose, some of the things that you want to look out for are, again, that mental confusion, not knowing where they are, what's going on. If a person's losing consciousness, if they kind of pass out and you say, hey, wake up, and they're not responding to you. If a person's vomiting intensely, and this is while they're still in the period of drinking, generally speaking. This is not like vomiting in the context of a withdrawal, many hours later. If anyone has a seizure, trouble breathing, slow heart rate, cold or clammy skin, sometimes their fingers or their lips will turn blue. Their hands might feel a little sweaty and clammy, and just generally dulled responses, or no gag reflex. So it could be because we don't want the person to choke on their vomit. So if we suspect that there might be an overdose going on, we need to call 911 immediately. Maryland has oh gosh, Good Samaritan laws within the state that basically say if a person is overdosing, and you call 911 to get an ambulance or police out to that scene, you or the other person are not going to be charged with drug related crimes, if you called because you need to get medical attention for the person. This is really to reduce the number of people who are either just dropping somebody at the ER and leaving, or just abandoning a person who is clearly overdosing on alcohol or any other types of drugs. So again, there are some limitations to that. I think if you have, enough heroin to, have a major distribution going on, you might still be in trouble for that. But again, they're not going to charge you with minor possession charges, drinking underage, or things along those lines. The most important part is making sure that people are safe. So don't be concerned about that in the state of Maryland, that, if you are 20 and you and your friend are out drinking and they have alcohol poisoning, you suspect they're overdosing, don't worry about getting in trouble, just get them help immediately. Make sure you're not trying to give the person food or water if they're overdosing. We don't want them to choke. And be prepared to give information to the paramedics. So, who they are, what they've drank, if they have any other medications, allergies, other medical issues that might be contributing to the overdose, making sure we're not leaving the person alone. Because again, they could vomit, they could get injured in some way, fall off a couch perhaps, or, in talking about sexual assault, it might leave the person vulnerable to assault in that way as well. It's also important to know that, thinking about the video, talking about how alcohol can dull our responses, it can dull our response to pain. So even if a person is significantly injured, if they're drunk, they might not feel that pain. So a person might have, like if they fall down the stairs, they might have even a spinal injury, but not realize it. So, which is also another reason why, there's the depiction of bar fights and, people getting drunk and fighting and hurting one another, and not necessarily feeling pain. If the person's unconscious, we want to make sure we're putting them in the recovery position to help prevent choking and to help keep them from, again, rolling off any couches. We want them to be on the floor. If the person's body temperature is dropping, covering them up with a blanket. So if you're not familiar with the recovery position, this is kind of how it's done. You want to sit on one side of the individual, move the opposite hand up underneath their face and the other hand straight up, and then very carefully, because we want to keep their spine in one straight line, we're going to put a hand on the shoulder and a hand on the hip, and we're going to roll them towards us. So that way the one hand is up and they're supported on the other hand. Then we use the top knee to then help prop them up so they don't then fall over onto their stomach. And this is the safest position for somebody who is unconscious and is potentially overdosing. So an overdose is something that can happen to anybody at any point while they're drinking. It doesn't necessarily indicate that a person is an addict or has an alcohol use disorder. Anybody who goes out to a party and has too much to drink, it might be your first time drinking ever, you can overdose. So that's why we talk about alcohol use disorder as something different. This goes beyond, and it gets to a point where a person is unable to stop or reduce the amount of drinking despite any consequences that they're having. So it might impact their relationships with friends, with their spouse, with their children. It could get them fired from work if they're not showing up or showing up intoxicated. It can cause liver damage. And even though these things are happening, um, if they are not able to reduce their drinking or stop their drinking, even though these things are going on, this is a pretty important sign that the person might be actually dealing with an alcohol use disorder. It also comes to that physical tolerance I mentioned earlier, where a person has to drink more and more to feel the same effects. So to get a little buzz going on, instead of having one drink, a person might need to have 3, 4, 5 drinks. Risk factors for developing an alcohol use disorder: the earlier a person starts drinking, because again, our brains are still developing until we're about 25 years old. So if we start drinking at 12, 13, 14 years old, um, drinking that alcohol is going to prevent the brain from doing some of the things that it needs to do, especially if we're drinking often at that age. If we have a history of addiction in the family, there is a genetic component. So that's something else that would make a person more susceptible to an alcohol use disorder. And also having other sorts of mental health conditions or traumatic experiences. So if a person has something like post-traumatic stress disorder, depression, or anxiety, they're at a higher level of risk of developing an alcohol use disorder. The good news is that treatment does exist and people do have recovery from alcohol use disorders. There are talk therapies that exist, support groups like Alcoholics Anonymous, and there are actually medications that can help prevent drinking or make drinking very uncomfortable, things like antabuse, Camprol, and naltrexone. So there are a number of different ways that a person who is dealing with an alcohol use disorder can get help. All right. So now that we've talked about, again, this was all factual information. It was not meant to scare, it's meant to inform and meant to make sure that a person has all of the information when they decide they want to drink or how often they want to drink. I think oftentimes people don't realize how prevalent some of these problems can be. And when we're aware of them, we know what to look out for, not just within ourselves, but in the people that we care about. So, how do we drink safely? One of the first things that we can do is making sure we're not drinking alone. Because if we're drinking and we're by ourselves and we overdose and we pass out, there's nobody there that can help us. So we definitely want to make sure that, we're with people and we're being safe in that way. If we're going out and having drinks, make sure you have a plan, that there is a designated driver. And me and my friends always in college had the no person left behind rule. If you came with us, you're leaving with us. That means nobody leaves with some random person. If one person gets sick or is kind of done, everybody goes together. Safety in numbers in that way. Making sure that we're watching our drinks, watching the bartender pour. How much alcohol are they actually putting in your drink? Is it maybe more than that 1.5 ounces? Again, is it a full 16-ounce glass of beer? And it also helps to make sure that nobody's putting something into our drink. They're not using any sort of date rape drugs. We want to make sure that we're paying attention to how much that we are drinking. This is why taking shots can be really dangerous for a lot of people, because if we're just lining them up and taking one after the other, your body has no time to process that alcohol. And so you'll go from sober to all of a sudden, when that hits, you will be very, very drunk very quickly. So making sure we're spacing our drinks out, we're drinking slowly, we're not just, sticking a straw in our Long Island iced tea and chugging it down all in one go. We want to, be aware and be present of how much we're drinking and how quickly we're drinking. Making sure we have food in our stomach before we go out. Um, Again, it doesn't stop the alcohol from being processed and getting into our bloodstream, but it slows the process down. If alcohol is the only thing in there, that's all our stomach has to process, and we're going to get drunk much more quickly. Um, Having, whatever food it might be, even if it's a salad, it just slows down that processing enough so that, if we're drinking slowly, we're mixing in water or other non-alcoholic beverages. We're mixing it up as we're going through our evening. These things will help prevent us from getting too intoxicated, from having a horrible hangover the next morning, and just generally making sure that we are safe. And we have to be really careful when we're mixing alcohol with caffeine and with other drugs. Again, I mentioned earlier about the opioids and the benzodiazepines, how they all depress our respiratory systems. If we are drinking alcohol and caffeine, they do the opposite thing. Caffeine um, excites our system, makes our heart rate go up, our blood pressure go up, all that kind of stuff. It's supposed to keep us awake, but alcohol is a depressant. So basically, you're asking your body to do two different things at the same time. And depending on how much what your intake is of both of those, that can be dangerous as well. Um, and when people always say that giving somebody coffee will help them sober up, the caffeine will help them sober up, and really all you get is an awake drunk person when you give them caffeine. um, and it's important to know that sex and alcohol do not mix. When an individual is intoxicated, they cannot consent to sexual activity. So, despite the TV and movies and all of, reality shows that show that, oh yeah, just have some drinks and, you'll feel good and you'll feel sexy and you'll be able to, not think about it and have sex. But again, if you or if your partner are intoxicated, you are unable to consent to sex. When we talk about not going out alone, bystander impact is why this is so important. We need to be looking out for each other. And this isn't necessarily always just the people you came with. There are many stories out there about, um, women who've gone up to other women who appear to be on a date with somebody who is being overly pushy or overly handsy, and helping each other out, or bartenders that have like code words that a person can give, and they'll call the police or help the person get a ride safely away from the environment or the person. So making sure that we're really looking out for each other in these types of environments, and that if we see something, say something. If we have a friend and they've had a couple drinks really quickly, it's okay to say to them, like, that's enough. You've had too many. You're getting a little uh, out of hand here. It's probably smart if we go home, or you just switch to water for the rest of the evening. And if you don't feel comfortable intervening yourself, pull in somebody else that you trust. If you've gone out with a couple of friends, or again, if you're in a situation where it's just you and a friend, and the bartender is a nice person, asking the bartender to make sure that they're not served anymore. And we want to make sure we're holding our friends accountable. Making sure they're not driving while intoxicated. And if we have a friend that we see is, hitting on somebody who looks excessively drunk, or maybe feeding alcohol to somebody, and you worry that their intention is to potentially have sex with this individual, holding our friends accountable in that way as well. And if you know somebody that is assaulted, be there and be supportive of them, and encourage them to get help and support, to, go see a safe nurse at the hospital. If a person has been raped, getting a rape kit, calling the police, but making sure we're doing so with that individual's permission and that they're on board um, with that. That's not something we want to do behind their backs. So alcohol and sexual assault, like they're very intertwined. Oftentimes when people are out at, a bar or a party, perpetrators often target intoxicated individuals. They look for the people who are drunk, who are having trouble standing, who are maybe slurring their words, or that they've just seen, taking a whole bunch of shots, because those people become vulnerable. Perpetrators can also encourage potential victims to drink heavily. Again, giving them multiple drinks. Oh, let me buy you the next round. Let me buy you the next round. We often talk about date rape drugs like Rohypnol, but alcohol is by far the date rape drug of choice. So it's not always that we have to look out for somebody putting things in our drink, but somebody who's giving a lot of drinks to you or somebody you know. And when we've had a lot of drink, our cognitive capacity declines, our motor skills decline, and it makes us more vulnerable to a perpetrator. You can't run and you can't fight if you're unconscious. And oftentimes perpetrators are drinking as well. It's not just the victims that they're trying to get intoxicated. Again, we talked about inhibitions being reduced if a person is drinking. So a perpetrator really focusing on the short-term positive rewards. I want to have sex, I want to feel good. I'm not thinking about what it's going to do and how it's going to impact this other person. They're not thinking about the negative consequences of their behavior. They're not thinking I'm about to sexually assault somebody necessarily. Their impulse control is reduced. Just again, not thinking clearly, not making good decisions. And once a person's decided to do something, it becomes more difficult to stop themselves once they begin engaging in that behavior. So alcohol can also negatively affect the perpetrator in that way as well. And as I say that, I will also very, very strongly say being drunk is not an excuse for sexual assault. Whether the perpetrator is drunk, whether the victim is drunk, it does not matter. Sexual assault is sexual assault. And again, this is why we talk about bystander impact. And it doesn't matter if your friend is a potential victim or a potential perpetrator. We need to hold each other accountable, because being drunk is not an excuse for sexual assault. If the perpetrator comes back and says, well, I was drunk, I wasn't thinking about, what I was doing, that doesn't matter. They still assaulted somebody. The next video I'm going to show is a video about consent. And I think, this talks a lot about, like obviously sexual consent, but different scenarios that might arise and how to kind of think about it in a way that makes it more understandable, that why it doesn't matter if someone is, drinking, that they cannot consent. So hopefully you'll enjoy this video.
Only 1 in 3 Canadians fully understand what consent is. So Western, let's talk about it. Let's think about consent like a bike ride. If you wanted to go on a bike ride with someone, you'd say, hey, I'd like to go on a bike ride with you. And they'd be like, hey, I'd like to go on a bike ride with you. Boom. Put on your helmet, kid. You're going on a bike ride. You might hear things like, this feels great, or keep going. These are ways you know they're enjoying the bike ride. Maybe not those ones. If they said no, then that's that. They do not want to go on a bike ride with you. You don't toss them up on a bike and say, oh, come on, it'll be fun. No is no. And if they don't say anything at all, it's still a no. The absence of a yes is a no. They could say, heck yeah, or I might want to. And you put on your biker shorts, get the bike, grab the helmets, and in that time, they decided that they don't want to and start to backpedal. And that's okay. They aren't obligated to go on that bike ride. You'll just have to bike on your own. Oh, and being dressed in bike shorts and a helmet doesn't automatically mean someone wants to ride a bike. It's quite presumptuous to think they do. Even if you happen to be in a relationship with your bike partner, you have to ask each and every time. Say your bike partner has had a couple of drinks, and we're not talking about water. They're not ready to go for a bike ride, even if they've told you they are. A drunk yes is not a sober yes, and by law, you need a sober yes. Oh, and just because you bought them drinks all night, it does not entitle you to a bike ride with them. Same rules apply if they're unconscious. The conscious people can't ride bikes, and they definitely can't say yes to doing so. The number one priority is to make sure they're safe. Even if they're just sleeping, they can't say yes to a bike ride. And it can be a scary thing to wake up and find yourself on a bike. Imagine your boss telling someone, "You can only work here if you bike with me to work." That's crossing the line. It would be an abuse of power for a boss or a person of influence to suggest such a thing. And just because someone wanted to go for a bike ride once, doesn't mean they'll want to every time. Maybe it was just a one bike stand. You can't say, "What are you talking about? We biked last night." You're simply not entitled to another bike ride if they don't want to. Maybe your fellow cyclist is totally cool with biking on paved roads. That does not mean that they are up for extreme mountain biking. You're not going to insist that they go speeding down a mountain with you if they are only interested in paved roads. That's uncomfortable territory, and you don't want to pressure your bike partner, do you? What if Alex here told you that Taylor really wants to ride bikes with you? Does that mean you throw Taylor up on a bike and say, "All right, let's start pedaling"? No. The only person that could say Taylor wants to go for a bike ride is Taylor. When all is said and done, riding a bike with someone should be fun, memorable, and hey, maybe a bit sweaty. But it can only be that way when everyone involved has willingly agreed to participate. So whether it's having sex or bike riding, consent is key.
So that video is from a university in Canada, actually, but obviously, uh, the same information applies universally. A drunk yes is not a sober yes, and we need to make sure that we are respecting our partners, um, even if it's somebody that we don't know, we just met for the first time. We need to make sure we are being safe both for ourselves and for the people around us. So I wanted to share some resources for anybody who maybe has been sexually assaulted or knows somebody who's been assaulted. At the college, our Title IX coordinator, Christopher Moy, essentially it is his responsibility to work with anybody who has been assaulted, especially when it's by somebody else who attends or works at the college, and to make sure that investigations are done properly and that the incident is not disruptive to anybody's academic process, because we know that when a person has experienced trauma, it can significantly impact their ability to learn. So Christopher's job is to make sure that we are taking away some of those barriers to learning to make sure that everyone can continue to be successful. If something is happening on campus, please call, public safety. They have the new number that will hook you up to all three campuses, 240-567-3333. Counseling and advising are actually the confidential resources on campus. When it comes to Title IX, professors, staff members, everybody is obligated to disclose to Christopher Moy if a sexual assault or rape has been reported to them. That is a mandatory requirement of us. However, if you make an appointment with somebody from counseling and advising and speak to them, they do not have to disclose that to Christopher Moy. They may have to relay information if a crime has occurred on campus, but they don't need to use names or anything along those lines. So if you need to speak with somebody, but you're not necessarily ready to report the incident, counseling and advising is the confidential resource where you want to go. This Shaw Center, we also on our website have a number of different resources that are available for individuals who have been assaulted or dealing with substance use. We have a list of organizations in the community that anybody can reach out to and get some help and support. There are also a number of substance abuse resources locally. There's Alcoholics Anonymous, which I mentioned earlier. Al-Anon is a group, again, an anonymous group for family and teens of somebody who is considered themselves an alcoholic, where they can go and get support as a loved one. Montgomery County has outpatient behavioral health services and substance abuse. Plus, there are some private organizations like Born Free Wellness Center up in the Germantown area, Counseling Plus down in the Tacoma Park area, and Family Health Center, which I believe is in Gaithersburg. So there's a lot within the county. There's much more than this. These are just a couple that I picked out to share. So please do, if you or somebody you think might be struggling with their alcohol use, let them know that resources exist and that treatment and recovery are 100% possible. Some other sexual assault resources in the community. The county has a victim assistance sexual assault program. There's MCASA, which is the Maryland Coalition Against Sexual Assaults, the Maryland Network Against Domestic Violence. Again, sexual assault and rape can occur within the context of a relationship or a marriage, and that would fall under the umbrella of domestic violence. And again, in DC, there are also hotlines available as well if you don't live in Maryland or Montgomery County. National resources, I think some of the important ones to point out would be the LGBT National Help Center. Again, oftentimes we'll talk about sexual assault or rape as a male perpetrating against a female, but within the context of same-sex couples, there can still be sexual assaults. And again, the malesurvivor.org website, because again, men can be sexually assaulted by women as well. So please make sure, regardless of who you are or how you identify, know that there is help out there and available to you if you have been the victim of sexual assault or other crime. So that's all I have for you guys today. Thank you so much for joining us. And if you have any additional questions, I really encourage you to check out the Shaw Center website, see what kind of resources that we have available there, and check out some of our other educational videos. Thanks so much.